blurred vision for distance, difficulty while driving at night due to oncoming headlights, difficulty while going into bright light, or very poor vision in dim light could all be signs of cataract. Hi, I am Dr. J. Mathew, cataract specialist at Dr. Agarwal's Eye Hospital, Trivandrum. Cataract is a normal age-related condition of the eye where after the age of 50, your natural lenses in your eyes become opaque and gets more opaque as you grow older. Everybody gets affected by cataracts. Depending on the type of cataracts, your vision may get affected early in the process or maybe later. But whatever the cause, cataracts have to be treated to recover your vision. If you let the cataracts grow untreated, you will have reduced vision, difficulty in doing your normal day-to-day activities like reading, using the computer. Cataract can only be treated by surgery. There is no medical treatment of cataract and there are no alternative treatment methods. Surgery has evolved in such a way over the past many decades so that now it is a very minor surgery, painless procedure where your downtime from regular life is minimal. The new advantages of what we call phacoemulsification cataract surgery, the incision for doing a cataract surgery is minute, less than 3 millimeters. So there are no stitches required, there is no injections required to numb your eyes. You have options of monofocal lenses, enhanced monofocal lenses, multifocal lenses, even new extended depth of focus lenses which give you a wide choice of what vision you want after surgery, whether you want glasses or don't want to wear glasses, whether you have clear vision for distance and near, you have a lot of options. Because it's a minor surgery, there is not much post-operative downtime after the surgery, where after a few days you will be back to your normal life, driving, traveling, getting back to your normal way of life. For further inquiries, please visit Dr. Agarwal's Eye Hospital at Trivandrum. Thank you.